Okay, so hello, it's an evening right now, and I'm going to be performing the assessment for the abdominal assessment. And what I'm going to need for this assessment is this pen light, and I have gathered all of my equipment right here, but I'm just going to place it in my rack. It's accessible. So, good morning, sir. I am Dr. Danber. I'm going to be performing the abdominal assessment for today to check for any abnormalities. May I have your name
My name is Abson.
and your birthday?
My birthday is October 31, 2020.
Okay, how old are you? Sir, have you went to the bathroom earlier?
Yes.
You voted, okay. And are you comfortable in your position?
Yes.
Okay. Um, should only expose the abdominal part because that's going to be the only necessary areas that I'm going to be checking. And, okay, performing hand hygiene. So, for the first assessment, I'm going to be inspecting for the coloration of the abdomen, and I'm noting no particular discoloration. One of the abnormal findings for that is jaundice, which is the yellowish coloring. I'm also looking for any purple discoloration, the flanks, that is called the gray Turner's syndrome, and I'm not finding any of that. It's based on my vision, and there's no pale areas, which is a white stretching tongue skin, which is the build-up of the abdomen, and there is also no redness or rashes or whatnot. And I am also inspecting for the vascularity of the abdomen. The abnormal findings for that is the the veins may be seen with sclerosis, which is the obstruction of the inferior vena cava, or portal hypertension. And I'm also noting for any scars. So there aren't any presence of scars or lesions I'm finding. And for the stretch marks, I'm going to be inspecting that with my pen light, which fortunately doesn't work. So there aren't any stretch marks, which isn't really typical for me. I have stretch marks right here, but they should be white if they're old stretch marks. If they're new, they should be pinkish or pink. I am also noting for the umbilicus, which is the navel right here. It should match the rest of the abdomen's coloration. In this case right here, my patient doesn't seem to practice good hygiene because it's way too colored. Then I'm inspecting for the contour of the abdomen. I should look just a little bit above, beneath the surface. I'm noting if it has any, if it's sunken or not. But my patient's contour of his belly is normally rounded, evenly rounded. It's also normal if it's sunken for other patients who aren't too skinny. Those patients are particularly scrawny because they may be suffering from a condition or starvation. I'm also assessing for the abdomen's symmetry. So the abdomen my patient has seems to be symmetrical. That indicates that he doesn't have any extended organ that is obstructed, which causes enlargement and whatnot. And as he is breathing, I'm also noting its pattern and if it's abnormal seeming, but he doesn't have that. So he also doesn't have any bowel obstruction, and I'm observing for pulsations as well. If there are any abnormal pulsations, that may be an abdominal obstruction as well. Okay. Then normally we shouldn't be seeing any peristaltic waves, and there's none of that. So okay, that's it for the inspecting juncture. Okay, so now I'm warming my diaphragm, my stethoscope against my hand. We're gonna be auscultating the four quadrants of this abdomen, and we're gonna be doing it clockwise for at least 1 minute, 1 minute each quadrant, and I'm gonna be noting for its pitch, its intensity, and sound. And I'm also gonna be looking for rhythms, which is the high frequency sound, which indicates obstruction or gastroenteritis as a result of being given laxatives and diarrhea. So we're going to be starting with the right lower quadrant, so sir, touching your abdomen. One minute each quadrant. Usually you're going to be hearing 5 to 30 swish sounds within a minute. Within a minute clockwise, so this direction. Sliding. Okay, so there doesn't seem to be any high frequency sounds, so there isn't any distension or obstruction in its abdominal lines. We're going to be auscultating over the abdominal aorta. Just lie around here. We're going to be looking for release. Okay, there doesn't seem to be any bruise in this area. Let's check the iliac crest. Just get some around the sides. Of course, the other side as well. Okay. So, sir, I'm going to be checking your this area of your body. So, just you're going to be auscultating his femoral artery. This lateral side of his also using the diaphragm of my stethoscope. Okay, so there is no swishing sound, so there isn't any abnormality or aneurysm or AS, which is the renal arterial stenosis. Okay, so okay. This time I'm gonna be using the other side of the stethoscope, which is your belt. We're gonna be checking the epigastric and umbilical areas for if I'm gonna hear any venous stumps, which is the collateral circulation as seen in the cirrhosis of the liver. Checking all 9 quadrants. This to be each quadrant. Okay, so that seems to be fine as well. Now I'm gonna be auscultating for friction rub around the over the liver and the spleen. We will listen for any crackling sounds. Should be around the left rib with the diaphragm of the chest also. Switching this again. Make sure that works. We'll be checking the liver. This is the spleen, which is the left side of Okay, so I don't hear any crackling sounds, so it should be a good thing. There are no high pitch or rough sounds or grating sounds. So that's there is no refraction or any abscess, which are abnormalities. Okay, so now I'm going to be percussing lightly and systematically among all the four quadrants, clockwise, up and down, over the abdomen. Generally, there should be tympani predominantly in this area, and I'm going to be noting if I hear any dullness and from tympani to dullness. So how we do this is we start with the lower quadrant, ano lang upwards. Slight overview. Now I'm going to be starting with the this area right here, which is your fourth intercostal space. And I'm going to measure when I stop hearing the tympanic sound to dullness. That is the approximate size of your liver. Of course, as usually seen among patients with uh, that are normal, there's around 2 centimeters in size of the liver. Um, Now I'm going to be percussing the spleen posterior to the left and axillary lines for your MAL and percuss downwards. I'm going to be noting for its dullness so that I can determine if my client has the enlargement of this the organs within this area. Sir? Brother? This is his mid-axillary line. Okay, so it's normal. Okay. Beda tayo. Uh, okay, so I'm going to be performing blunt percussion over the liver. I'm going to be checking if there is any infection or inflammation in this area. There should be no tenderness elicited. So, sir, I'm going to be hitting this area moderately hard, so just tell me if you feel anything. Good job. Tama, sir. Back up. Feel anything? Okay, so I guess my patient is good to go on that juncture. So if there's any information. Now I'm going to be performing blunt percussion over the posture post vertebral origin from 12 rib. I'm going to be looking for any sharpness, pain, or any tenderness. Um, There's no noise. Like, like, you respond that verbally.
Uh,
So, um, for my findings of auscultating this dorsal region, there isn't any abnormal findings. Okay, so now I'm going to be performing light palpation all over this abdomen to check if there are any tenderness at the abdomen. Just going to palpate lightly in a dipping manner. Maybe it's still my fingers. Preferably for quadrants. At the same time, I'm also going to be palpating these organs deeply, about 5-6 centimeters deep. Or just tell me if you feel any slight tenderness. As I'm doing this, I'm also detecting for any masses, especially in this umbilical area. So involuntary reflex regarding the reflect peritoneal irritation and severe tenderness or pain may be related to trauma, infection, or tumors. A mass detected is, in any quadrant may be a cyst or an enlarged organ or aneurysm. So now I'm going to be palpating the aorta using my thumb and first finger and palpate deeply in the epigastrium slightly to the left of the midline to assess pulsation of the abdominal aorta. Around here. So a hard, no, a wide body pulse may be felt within the abdominal aorta, which is caused by aneurysm. So now I'm going to be palpating the liver, and I'm going to stand to the right side of my patient. Stand to the right side. Like this. So I'm gonna be noting for its consistency and just around this. Okay, so sir, may I ask you to your name? So, the liver is usually not palpable, and if it is palpable, it should be from even in spleen. So now I'm going to be palpating the spleen. I'm still going to stand in its right side. I'm gonna reach for the abdomen with my left arm and insert. May I ask you to inhale? Okay, thank you. So the spleen is seldom palpable at the left coastal margin. So now I'm gonna be palpating the umbilicus and kung saan. Okay, so now I'm gonna be palpating kidneys. Um, palpate the right kidney and just support the right flank. See, so I'm just gonna lift my left arm and my ass with the inhale. Okay, thank you. So the kidneys are usually not palpable. If palpated, it should be smooth and rounded. Now I'm just gonna do the same procedure. I will be standing to the left side of my patient. Do the same procedure to the left side. Okay, thank you. So okay, now I'm gonna be palpating the urinary bladder, and I'm gonna start at this what is it called? Symphysis pubis. Around here, I'm gonna be doing it inward and upward. I can't actually touch this urinary. Okay, so the urinary bladder is neither palpable nor tender when it is empty. So, okay, now sir, you can now sit up because the procedure is now concluded. So, hygiene and of course the documentation and everything, the abnormal findings and all that. So thank you for participating in this intern demonstration. You've been very kind and great to sleepy. So that's about it for my intern demonstration. Thank you.